On 4 tonight, an area hospital claims they cannot find thousands of doses of fentanyl and other controlled drugs, all meant for patients.
And the family of one nurse who is accused of taking those drugs is speaking to News 4 Chief Investigator Lauren Traeger.
By now, you've heard fentanyl is the cause of many overdose deaths in the region and the country, but it's also used in hospitals very effectively and safely for sick patients to help relieve pain. But in documents we've obtained, one local hospital says a very large amount of their drugs went missing. SSM St. Clair and Fenton sent a complaint to the State Board of Nursing in June last year. They claim that one nurse, whom News 4 is choosing not to name, took hundreds of vials of fentanyl and other drugs from their dispensing machines. That nurse was fired, but the hospital said there was an ongoing investigation into others in the unit. In all, the hospital told the state that nearly 4,000 vials of meds were missing. They fired the nurse, and now his family is speaking out exclusively to News 4, claiming he was simply the fall guy.
We're talking about 2 gallons here of fentanyl and Versed.
In the medical field themselves, they wanted anonymity, but they also want to ensure more is done so that dangerous drugs don't end up in the community.
What do you think needs to happen?
I think there needs to be a revamp in policy and regulation. SSM needs to be held accountable for their actions and not following policy and regulation. My dad's name needs to be cleared.
That nurse, according to documents and his attorney, admitted to taking some of the drugs, but only a fraction of the amount SSM said was missing. All this further complicated, though, by the fact that the nurse is now deceased. His death certificate says from chronic alcoholism. That could mean the investigation into his actions is now over, but there are still lots more questions into all of this, and we're going to keep digging and bring you any more details we receive. I'm Lauren Traeger, News 4 Investigates.
News 4 reached out to the DEA, who says they cannot confirm nor deny any ongoing investigations. We also reached out to SSM, who just sent us a statement saying, at SSM Health, we take drug diversion matters very seriously. We investigate and report to all appropriate authorities, including regulatory and licensing agencies, and fully cooperate with any law enforcement investigations. All investigations relating to this matter have been closed. In keeping with our mission and values, we provide ongoing support, including privacy, to all those involved.